Welcome to Concept in Medicine. In today's session, we are taking a deep dive into something else. We are going to be answering a particular question. And what is this question? The question is, am I pregnant? So with that, we are going to be looking at the 10 early symptoms you might be pregnant. Let's have a look at the first one. The first one is going to be mixed periods. In this case, mixed period is the most obvious symptom that prompts majority of the women to do a pregnancy test. But it does not mean that all mixed periods are caused by pregnancy. You take, for example, a woman taking birth control pills and stop taking them. They may have mixed period for some months. So mixed period is not always caused by pregnancy, but it is the most obvious symptom that prompts majority of the women to do a pregnancy test. Let's move on and have a look at the second symptom. The second symptom, we call it morning sickness. And for the morning sickness, it is also known as nausea and vomiting in pregnancy. It means for this, in early pregnancy, the woman would be feeling sick majority of the time, where she may feel nauseous and vomit or not vomit. With the cause of the morning sickness, it has been associated with high levels of circulating beta-woman chorionic gonadotrophin, which is produced in pregnancy. Even though the name is morning sickness, it can happen at any time of the day. And usually, its onset is from 4 to 6 weeks of pregnancy. Let's look at the next symptom. That's the third one, which will be fatigue. In pregnancy, there are hormonal changes that occur. One of them is an increase in the level of a hormone known as progesterone. And this hormonal change causes the woman to feel easily tired. And this tiredness could last for a period of 12 weeks. The next symptom we want to look at is sore breast. With this, once you are pregnant, your breasts become larger and feel tender. You will start experiencing tingling sensations around your nipple. And your nipple may stand out and become darker. The veins in your breast may become conspicuous, that is, becoming more visible. And if you're having this, it may be a symptom of pregnancy. The next symptom that we want to talk about, that is the fifth one, is food aversions, where when you are pregnant, you tend to develop high sensitivity to certain odors. And you also tend to dislike food that you previously liked. In certain cases, some pregnant women in their early stages tend to crave and take in substances with no nutritional value. Which substances are we talking about? We are talking about clay, we are talking about soil, we are talking about ice. And when they do this, we refer to that as pica. And pregnancy is just one of the causes of this pica that we are talking about. Let's move on and look at the next symptom, which may tell you that you are pregnant. The next symptom is light spotting and cramping. When you start seeing spotting around the time that you usually might be having your menses, it denotes that you are having what we call an implantation bleeding. And what does this mean? Implantation bleeding usually occurs when the fertilized egg attaches to the lining of your womb. And this could cause the bleeding. And in certain cases, you may be experiencing cramps during that same period. It may be an indication that you are pregnant. The seventh symptom that I want us to look at is frequent peeing. Why frequent peeing? Because in pregnancy, the volume of the blood increases, and as it increases, the kidney tends to excrete more water in the form of urine. That is why frequent peeing may be a symptom of pregnancy. The eighth one is mood swings. In pregnancy, hormonal flooding tends to affect certain chemicals in your brain. We refer to those chemicals as neurotransmitters. And these neurotransmitters are responsible for your mood changes. So in early pregnancy, you may either become anxious, depressed, or have heightened emotions, which may be bad or good. The ninth symptom you might be pregnant is bloating. And what is responsible for this bloating? Again, in pregnancy, the level of hormones tends to increase. Again, in pregnancy, there are hormonal changes. An example is an increase in the level of progesterone. And when the level of progesterone increases, it tends to cause the relaxation of smooth muscles all over your body. And these include the digestive tract. In this case, the passage of food through your intestines becomes delayed, and that could cause bloating. And in this scenario, you may feel your clothes becoming tightened around your waistline. Then the final symptom is constipation, which has to do with the high levels of progesterone in pregnancy. And with this, again, the reason is the same, where the high levels of progesterone would cause the relaxation of the smooth muscles in your body, including the digestive tract. And when that happens, it tends to slow the passage of food through your intestine, and that may give rise to the bloating. In case you have any of these 10 symptoms, you might want to do a pregnancy test and see your doctor. I believe we have learned quite a number of things. If you have any question, kindly leave it in the commentary section. And don't forget to subscribe to my channel. I shall be bringing you more similar health education talks like this. My name is Dr. Del, and this is Concept in Medicine. See you next time. Bye-bye.